I'm going to start off on my second day in Cuba. I developed an episode of back pain and spasm. It was 5 o'clock in the morning. I was taking a shower, and my back just went out. And I was like stuck there, kind of in distress and in pain. Right away, I went into sort of a trance of what happens to me when I'm in pain, or I'm like here in the United States. Normally I'm out for 2 weeks, but first of all, I'm thinking about sitting in Montefiore for 6 hours, waiting to see a doctor. Then when a doctor sees me, he's questioning my pain because he doesn't want to give me narcotics, because he sees me as a black man. He thinks I'm a drug addict. And I'm still in pain, and I'm still waiting, and I'm thinking about all this as I'm in pain, and I don't know what I'm going to do next. And as I'm in this trance of thinking about what I normally go through when I'm in this distress, start thinking about, is my insurance going to cover all these exams? Then I just kind of come out of it, and I yell out. And the security guard outside my door comes in. Yo, what's going on? What's going on? And I tell him, I'm in trouble. My back, it just went out. He goes, don't worry, we got you. Like 5 minutes later, a doctor and a nurse in their nightwear, but she was wearing her nightie, and he was wearing shorts, just come rolling into the room, and they just like, and I'm like, sweating and in a lot of pain, and they just like, we got you. We got you. Don't, it's not. They take me right into their office, and right away I get an anti-inflammatory and a muscle relaxer. And he says, and in 2 hours, I'm gonna send for you, and I'm gonna do acupuncture. But at the same time, I'm kind of worried, and I say, oh my God, I'm not going to be able to help out in this delegation. I'm not going to be able to do anything. I'm here 2 days, and I'm already a mess. Once again, like superheroes, we got you. And I'm like, okay, yeah, all right. I hear that all the time in the States. He says, he laughs. The doctor laughs. He says, we got you. Don't worry about it. I said, all right. So within 2 hours, I come back. I get an acupuncture treatment, and then a massage. And within 5 hours, I was walking around. It's like the first time that's ever happened. Normally, when I get these episodes, I'm out for like about 2 to 3 weeks with physical therapy. So within 6 hours, I was still a little tight, but I was able to just walk around and still have conversations with amazing comrades that we went out there. I mean, Nate, Nick, Ariela. You guys were amazing. I was driving them nuts. I was like, get this for me. I wish I could just take them to my house now. Because for 2 weeks, I ran with that. I was like, okay, get me my bag, this, I need cigarettes, get me this. And they were like on point, like there for me. So that, the next day, I went to the doctor, and I go, first of all, I try to offer him some money. Not offer him some money, I try to give him a donation. Just, he refused to take the donation. He was like, nah, this is not what this is about. So I asked him, yeah, I mean, definitely Cuban doctors deserve a clap. So I was like, can I talk to you about being a doctor? He goes, sure. So I asked him why he chose to be a doctor. He says that being a doctor in Cuba is not about economic gain. It's actually a calling for him. He says that most people that become doctors in Cuba, it's actually a calling to help treat people and save lives. And not just in Cuba, worldwide. He says that if if you don't have this calling, go become something else. People just don't become doctors in Cuba because they want to gain money. And then he spoke about how doctors in Cuba are a part of the community. So each neighborhood has a doctor. It's called a polyclinic. A doctor and a nurse. They basically take care of you from the moment you're born to you die. They basically know your whole family. They know your whole medical, like we said, medical records. Because I even asked them about medical records. He goes, we don't need medical records. I know their grandmother. I know their grandfather. And basically, I know that his grandmother has diabetes, so that means I got to talk to this person about taking care of himself and eating right. Then he went into preventive care. It's not about making money. He says, basically, it's about, eating right, and it's about taking care of yourself and actually keeping the cost down. So he says, and then he tried to tell me about the United States. We were having a conversation about healthcare in the United States. So he was like, he wanted to know, what is my treatment for my back? So I explained to him about physical therapy, and it's a long treatment of like 2 or 3 weeks, and tons of medication and narcotics, pain blocks. He goes, you don't need none of that. And that is the problem. That is the problem. That is a money-making business. They're not taking care of, they don't care about anybody. And he says, I don't want to criticize the United States. He went into that. But I'm just having a conversation. He says, but they don't really care about anybody. That's a money-making business. If anything, they're killing people by doing all this. They're actually killing people. But so all doctors in these polyclinics are trained to do acupuncture. Sorry, I'm a little nervous. So the Cuban medical system spends more time in prevention rather than treatment. This prevents epidemic and disease from spreading throughout the island population. When a health hazard like the dengue, malaria, or dengue is identified, there's a coordinated nationwide effort to respond. Cubans no longer suffer from rubella, polio, or measles, and has the lowest AIDS rates in the Americas right now. It has the highest rate of treatment and control of hypertension. Because in the Caribbean, it's very high because of the type of food we eat, and it's very high. Cuba has one of the lowest in the Americas. All right. Is that a signal? Okay. So anything, they still do have hospitals, and any serious are referred to the major hospitals. But then it comes back into the neighborhood, and then is overseen by the neighborhood doctor, which is a polyclinic, and then it's overseen by the doctors to make sure that the patients are taking the medication. If someone's not taking the medication, the doctor will show up to your house. I did not show up to one of my treatment. He did come and knock on my door the next day, like, you did not come in for your massage. I'm like, okay. So doctors at all levels are trained to administer acupuncture, herbal cure, and other complementary practice the Cuban labs have not found to be effective. Cuban research develops their own vaccinations and treatment when medications are unavailable due to the blockade or when they don't exist. Right now, amazing research is being done on lung cancer in Cuba with the vaccine, which is amazing, which the United States could benefit from that if we just kind of like, but pharmaceuticals and the healthcare system in the United States does not want a cure. They want to make money on our account. In conclusion, it was a pleasant experience. I was quite pleased in the healthcare system in Cuba and how effective and humane it was. Just him touching my shoulder and saying, "I got you. You're gonna be okay." That's what it's all about. I wish one day for this system to be replicated in the United States so other people could experience this. Bloqueo no? Cuba sí. Bloqueo no? Cuba sí. That's it.